Medical innovation starts with medical discussion. Talking about the future and what comes next with Project Medtech.
Hello, everybody. I'm Lindsay Deneen, Director of Marketing and Engagement at Project Medtech, and welcome to another episode of the Project Medtech podcast. If we can help you in any way, or you would like to suggest a future guest, you can email us at info@projectmedtech.com. If conversations like this are helpful, that's exactly why we bring people together at our signature events, the Midwest Showcase, the Startup Symposium, and Coming to America. For more on our events that include networking, education, and pitch competitions for startups, check them out at www.projectmedtech.com. We even have sponsorship options if your company is also dedicated to accelerating medical technology to impact patient lives. So reach out today to get involved. The Project Medtech podcast is proudly sponsored by Ward Law. Ward Law Office, LLC is a boutique law firm specializing in the practice of patent and trademark law. They are committed to providing inventors, entrepreneurs, and businesses of all types with personal and professional services and are flexible to meet your unique needs. It is their goal to both educate on how to secure valuable patent and trademark protection and to provide high-quality services at rates affordable to independent inventors, startups, and small businesses alike. Without further ado, let's dive in.
Okay, Sean, welcome to the podcast.
Yeah, thanks. Happy to be here.
Yeah, so this is going to be our newest mini series at Project Medtech. It's called our 5 Things You Need to Know mini series, and you're going to be the first guest on this. So we're going to talk about packaging compliance on this one, but it would be great before we jump in. This is going to be a shorter podcast than we normally do. Oftentimes we'll go, anywhere between 30 and 60 minutes. This we're going to shoot for 15 to 20 minutes. But before we jump in, it'd be great for you to do an introduction to yourself and what you do now and what you do at packaging compliance.
Yeah, absolutely. So Sean Thompson, I'm a senior sales engineer at Packaging Compliance Labs. We're located in Grand Rapids, Michigan, and we support medical device manufacturers with everything involved with sterile packaging requirements. Been in the industry for going on almost 10 years. My 10-year anniversary is actually going to be coming up in a few weeks at PCL. Yep.
Right.
So graduated from Michigan State University studying packaging, and like I said, I was the first intern at PCL. And just a quick kind of overview on who PCL is. So as I mentioned, we are sort of the experts in medical packaging support. So we do that through 3 key aspects of our business. One being our ISO 17025 lab. So that's where we do all the testing that the FDA says, you must do to check the box for commercializing a product. So we'll talk through the 4 pillars of packaging today, which really kind of covers everything that you need to do from a packaging standpoint. So one being the lab, where we do all the testing that the FDA says you must do. Business unit 2 is our engineering services. So PCL has a team of packaging engineers on staff that really serve as the department for our customers. So an extension of their team. Whether that's helping with design, whether that's helping with equipment validation, really anything that a packaging engineer would do for an OEM, our engineering team supports medical device customers in that sense. And then lastly, bucket 3 is our ISO 1345 division. So that's where we do contract packaging, cleaning, and sterilization management. So really kind of an end-to-end approach as it relates to packaging for sterile medical devices.
Awesome. Yeah, and Sean, it's wild, we actually met in, I think 2021 or 2022. We were, I think it was right before I went full time into Project Medtech. We were going to an event in Grand Rapids, Michigan, and we had been connected. We stopped in. I think you were actually doing the packaging for one of our clients. Stopped in, got to see the facility, got to meet you, and it's so funny because you think back to those stories, and now it's like, I think we've seen you at every one of our events. You're now on the podcast, you're working with other clients that we share. And so it's just pretty cool to see this. So I couldn't think of a better guest to have on for, the first kind of kickoff to our mini series. So again, 5 things you need to know. And we want to give this so it's quick content for a company who's getting into the space, listening in, and just wants to know, hey, what are those things I need to get in my mindset when I'm thinking about packaging? So I'll turn it over to you to rip through the 5. I may interrupt with questions, but yeah, start with your first one.
Yeah, absolutely. So first things first is, knowing the device and what those device inputs are. That's going to ultimately lead to the design outputs of that packaging design. So thinking about the product, what sort of sensitivities are there? Is it sensitive to light? Is it sensitive to moisture? Is it sensitive to oxygen? That's going to help derive that sterile barrier choice. Weight, sharp geometries or features. If you have a breach, that patient safety is the number one thing to consider here when going through a design. So making sure that the design that you're putting in place is ultimately going to keep that product sterile and safe for use. Electrical components, battery operated, so many things to consider. One of my projects that I remember dating back a few years ago when I was supporting on the engineering team was an opportunity to support a design for, I want to say, almost 10 spinal instruments that would be used in a kit. So, tooling can be an expensive piece when you're going down the thermoform route. And if you have 10 devices, you don't want to have 10 different, sterile barrier designs to support those 10 products. So, working with the different thermoformers and coming up with a design solution that might be able to accommodate all 10 SKUs, if that's a possibility. Sterilization mode, that's critical as well. If it's going to be sterilized via ethylene oxide, you're going to need some sort of porous layer for the gas to penetrate through and back out. And then ultimately volumes and scalability and knowing where the customer is. So, are they looking for a long-term design solution that's going to be, ease for the manufacturing process, or are they looking to get to market as soon as possible to prove out their design? So many things to consider.
Yeah, that's super helpful. Okay, so that's the first one, which was encompassing of some bullets, probably like 5 to 10, and so that information is super helpful. If we have all of that, the device inputs for design outputs, and that is in place, is this where we're following that ISO standard? Was it 11607 that you mentioned? And then I guess, is that going to kind of take us through 2, 3, 4, and 5?
Yep, you got it. So once that design's been put in place from all those inputs, you have a sound design that's going to work for this product. Like you said, now it's time to start following the guidelines of ISO 11607, which is really the holy Bible for all things that you must do to get that product commercialized from those sterile medical device packaging requirements. So really starting with the first pillar is the make pillar. So what the make pillar is going to be covering part 2 of ISO 11607, and that's your process validation. So if you're purchasing a Chevron pouch from a converter and you have your sealing machine, you need to go through the process validation, which is going to be your IQ, OQ, and PQ. So IQ is installation qualification, really making sure that the equipment you're using, the sealing equipment, has been installed correctly and operates as intended. Next step of that process validation is going to be your operational qualification. So this is going to demonstrate that the packaging process windows are acceptable results at the limits of the process window. So when we're talking about sealing technologies, there's typically 3 critical process parameters. That's going to be dwell time, so how long that seal bar is making contact with the materials. It's going to be pressure. At what pressure is that bar clamping down on those materials? And then ultimately going to be the temperature. So how hot is that sealing bar? And when you're running through the OQ, you're testing the limits at the lower end and the upper end of what you deem to be sufficient, and that's going to create a clean, safe seal to move forward into the performance qualification. So performance qualification, that's going to demonstrate that the packaging process is stable and capable when running under normal manufacturing conditions. So what you're going to do there is you're going to essentially, be as production representative as possible. Make sure that the work instructions are clear to everyone. Make sure multiple people can be trained and successfully perform their tasks when creating those seals in line. Making sure that the line's laid out properly. Do we have enough people? Are their tasks making sense? Simulating any sort of shift changes, power outages. Really being as production representative as possible with that PQ.
Awesome. Okay, so that's two, and I have to laugh because I am not in the world of manufacturing or packaging specifically. Generally, I was always, my big area was testing the end medical devices for different safety things. But I hear Aaron use some of these phrases from our team. He's our chief operating officer who has a manufacturing background. He would use these things all the time, and I'd have to be like, Aaron, I don't know what any of this means. You need to actually spell it out for me. And so,
Yep.
thanks for kind of going through that. Okay, so let's move on to number 3.
Yep. So number 3 is going to be ship, and this is the big one that you can get hung up on. So what are we doing here? We're proving that you can ship your medical device to where it needs to go. Typically a hospital or wherever that final use environment is, and it's going to arrive there in a sterile state, meaning that there's been no sterility breaches and that the packaging is doing its job. It's protecting the device. So many things to consider here. As I mentioned, if there's 10 different products that are going into one packaging design, we want to test worst case. Worst case is such a common word in this industry. And looking at the different products that you have to consider, what one's going to be the worst case and what makes it worst case. Once again, going back to some of those design inputs, are there any sharp features? Which one of these products is going to be the heaviest? And then once you determine a worst case scenario, then you're going to go ahead and really do that shake, rattle, roll, as many people call it. So subjecting your package system to shock, compression, vibration, and really mapping out what it could expect in the real world from a distribution channel. And typically what we see is 2 main standards that companies are conforming to: ASTM D4169 and ISTA 3A. Those are both simulating small parcel shipments. So really, we're talking about dropping the box of medical devices, 6 times from 24 inches, then moving into compression and compressing that box. Then it's going to go onto the vibration table and, really shake up the products, for hours on end. And then a couple more activities. And then finally, more drops, with that final drop being 48 inches if we're following the ASTM D4169 standard. So as you can imagine, if you have, a 6-foot long catheter type system and you got 5 of those in a shipper, dropping that thing, from 48 inches, you really got to have a robust design in place to make sure that there's not going to be a sterility breach.
Yeah, Sean, it's so cool. I when I in 2016-ish timeframe, I started at NAMSA in 2015. I think the following year I had the opportunity to go out to California, Irvine, California, which was where NAMSA had they did shipping testing. And I got to see those tests run and kind of set up. And I think, the drop test is really cool. The compression test is cool. But watching the simulators for cars, or trucking, and watching the different shocks go up and down and shake things around. Then they had a airplane one as well, where it was like factoring in some of those things. It was just super cool.
Oh yeah.
To watch those tests, and I'd never seen I've never seen those before. So for anyone who's never seen this kind of testing before, I definitely encourage you to check it out. I know PCL has this stuff too. So yeah, it's pretty cool to see.
Yeah, and even beyond just the the shake rattle roll that I mentioned, you're also typically going to subject it to a climatic conditioning profile before you really beat it up like the UPS or FedEx will do. So usually you're running it through a frozen profile, followed by a tropical high heat, high humidity profile, and then lastly that desert profile. So really mapping out your distribution channels. You might be manufacturing it in Florida, and you might have a distribution center in Arizona, and the patient that's going to be using that product might be in Alaska. So making sure you're, back to that worst case environment. And if I had one thing to take away from the ship pillar is test the design out before you fully commit to the validations and you're fully invested in purchasing those materials. So we always recommend to do a feasibility test. So get some prototype samples, subject it to an even higher drop test than the actual DV. Maybe have it sit on the table an extra hour than what the true DV is. So it's almost like an insurance policy. You're really going kind of above and beyond on what you have designed and making sure that you have confidence moving forward.
Yeah, awesome. All right, give me number 4.
All right, so we covered make, we covered ship. Store is pillar number 3. So this one is all about how long can that product sit on a shelf. So different things to consider. It's typically revolved around the device cycle. So, how long is that device going to be able to be used? But what we're talking here is how long is that product going to remain sterile and it can remain on a shelf and still be safe to use. So ISO 11607, there's 2 ways to go about this. There's accelerated aging and there's real-time aging. FDA is going to require you to do real-time aging. So your samples need to be sealed up, sterilized, and then they just need to sit for, whatever that shelf life is. Call it 5 years, for example. So post real-time aging, you're then going to do some of those sterile barrier inspections like the visual, the bubble, the peel strength test. The FDA allows you to go to market with accelerated aging data, though. So it would be challenging if you had to wait, the 5 years to then be able to start, producing your device for commercial use. So accelerated aging is essentially baking your product at an elevated temperature to meet a simulated time point. So 55 degrees Celsius is the number one temperature that we see. It's usually recommended by those material vendors that say, anything beyond 55C, the materials might degrade in a non-realistic fashion. So 40 days in the chamber at 55C gets you to 1 year of shelf life.
Awesome. Yeah. These are things that I was familiar with as well, and things you can very easily get dinged on the final goal line here was this accelerated aging piece of it too. If you hadn't considered it in your test plan, I would say, all of these things. At Project Medtech specifically, we've probably worked with just north of 125 plus startup companies or medtech companies, and I've seen a company get dinged with the first 4 things you've mentioned here, and the cost and timeline is the problem, right? It's like the shipping piece. You didn't do the simulated shipping test, and then you fail it, and now you have to drive your product to your first clinical partner, right?
Mm-hmm.
Or the one you just mentioned where you didn't take into account aging. And accelerated aging, while shorter than 2 years, still takes time,
Yeah.
And so, that's another one where it's like, yeah, you tack on 3 months, like that's a big deal when it comes to different milestones and stuff like that. So love the first 4. Give me the 5th.
Yeah, and just one last thing on that is
Yeah.
that accelerated aging is definitely typically a bottleneck in the packaging process as a whole. So if you got that 5 year shelf life, it's just got to sit and bake for 200 days, and so it's start accelerated aging as soon as you can, and that's going to set you up for success.
Awesome.
All right. Last but not least is usability. So ISO 11607 was last updated in 2019, and they added section 7 to part 2, which is to consider the usability and aseptic presentation into the sterile field, or wherever the intended use of that product is. So there's 3 main things that you need to point to. That's identifying the opening feature. So, looking at that design, how do I open this? Where do I start to open this? The ability to aseptically open the product without contamination. So aseptic techniques to access that product. And then the third point is the transfer to the sterile fields, whether that's the dumping method or whether that's the hand pick method. And really, like many of these standards, it's pretty vague and up for interpretation. So many companies are doing it different ways. But there is an ASTM method that's actively being worked on that's going to help kind of guide you on how to go about considering the usability of that sterile barrier.
Awesome. And that is, we set at the top of this podcast, but we were going to try to do it in 15 to 20 minutes, and we are at 19:53 and counting. And so pretty impressive right there. We will have links to PCL's website in here, Sean's LinkedIn. And so if you're interested in learning more about this, we will also have, and I just want to be clear too, we were under 20. We're going over because of me right now. But we will also have a blog post about this as well. That'll be the additional feature to this. It'll be on Project Medtech's website. PCL will post about it as well. So we will have a written aspect of this where we kind of lay out exactly what we talk about and that Sean talked about. So thanks everyone for listening in. It was our first mini series, and Sean, thanks so much for being the first guinea pig on this.
Yeah, absolutely. Happy to do so. Thanks for having me. This has been great.
Yeah, awesome. Hang on for 1 minute. We'll chat offline.
Hi, I'm Freddie Coffey, Director of Marketing at Jumpstart. The Project Medtech podcast is proudly sponsored by Jumpstart Inc. Jumpstart's Trailblazer Accelerator helps Ohio's most innovative early-stage health tech startups fast-track their growth with tailored advising from serial entrepreneurs, non-dilutive funding to fuel their journey, and unrivaled access to a network of experts, resources, and investment opportunities. Whether it's improving patient outcomes, advancing digital health, or reimagining care delivery, Jumpstart provides the high-impact services and critical resources to bring big ideas to life. Learn more at jumpstartinc.org/startups.
Thank you for listening. At our core, we at Project Medtech are networkers, educators, and consultants. We meet you where you are to bring value and to create impact. We care deeply about helping medtech companies succeed right from the start, through to exit by providing consulting and fractional services, hosting impactful industry events, and of course, sharing incredible guest insights like the ones you heard today through our podcast. Please reach out at any time if we can be of assistance. Check out our website at www.projectmedtech.com or email us at info@projectmedtech.com.